I want to thank Dr. Talib Wasim and other organizers for giving me the opportunity to speak about quality improvement programs in surgery with a special focus on American College of Surgeons NSQIP program. I have no financial disclosure. Goals for today's talk are going over history of American College of Surgeons specific to quality, what is NSQIP program, how this program is different from other quality programs, how does NSQIP help participating hospitals, and other quality programs which are related or directly or indirectly to NSQIP. If you look at the history of American College of Surgeons, you can see they have a rich quality history over the course of almost 100 years now. As you can see from timeline that American College of Surgeons have developed and successfully implemented multiple initiatives, and as you can see, it's starting from issues of minimum standards for hospitals, to Cancer Commission, to Trauma Committee, Joint Commission, and accreditation of different subspecialties. For example, Surgeons Oncology Group, Bariatric Surgery, Breast Centers, and development of NSQIP. What is NSQIP program? The history of NSQIP program starts in 1990s when Veterans Hospital launched a quality program to improve surgical care for veterans. This program got national attention, and later American College of Surgeons launched ACS NSQIP in 2004. This program is a nationally validated, risk-adjusted, outcomes-based approach to measure and improve the quality of surgical care. NSQIP employs a prospective, peer-controlled, validated database to quantify 30-day risk-adjusted postoperative surgical outcomes, which provide a valid comparison of outcomes among all participating hospitals. If you look at this graph, almost 719 hospitals across the world are participating in this program. Mean bulk of those hospitals are in the United States, 585, with almost 96 hospitals in Canada. And this program has grown exponentially at an international level with sites all across the world, from Australia all the way to England. And I'm very proud to say that Al Khan Hospital from Pakistan is also a participant of that. How ACS NSQIP is different from other quality improvement programs. Most hospital-based quality improvement efforts are based on administrative or claims data by insurance companies. Claims data does not adjust for risk factors, for example, age of the patient. A 21-year-old young healthy patient is not comparable to a 75-year-old patient with comorbidities. NSQIP data is abstracted by a trained surgical case reviewer from medical record with a 30-day follow-up post-operatively, while claims data is generated electronically at the discharge of the patient from the hospital. The guiding principles for continuous quality improvement are setting up the standards, which are individualized by the patients, and they're backed by research, developing a right infrastructure like staffing models, appropriate nursing staff for patient to nurse ratio, general surgeon to population ratio, specialist requirements for community and setting up their high standards, equipment validation, processes and implementation, and implementing checklists for safety, like timeout before surgery and debrief after surgery. Maintaining that rigorous data is extremely important. Collection and validation from medical charts. The data should be backed by research, and also feed for more research. Post-discharge tracking system for patients, as it has been proven that a lot of complications happen when the patient is discharged from the hospital at home. And continuously updating your data. The last part is verification, which should be external peer review, and it creates public assurance about the program. How does NSQIP help participating hospitals to implement these improvements? American College of Surgeons offer hospitals and clinicians necessary tools, periodic reports, statistical analysis, and support to collect data and implement quality improvement initiatives. Benchmarking, for example, hospital-specific reports and compare them to the state level and the national level. Provide periodic reports, which are called semi-annual reports, and collaborative meetings to discuss those findings and try to improve patient safety. Access to best practice tools backed by research, and reporting software which can communicate with modern electronic medical records, and site audits in order to make sure the data is valid. If you go to American College of Surgeons website and click Quality Program Overview, these are the list of programs which are already in place. You can see the American College of Surgeons NSQIP program, and there are multiple other programs which are associated with it. For example, pediatric component of NSQIP, bariatric surgery component of NSQIP, trauma component of NSQIP, and American College of Surgeons Quality Verification Program. Most recently, American College of Surgeons have implemented enhanced recovery pathway programs to minimize the use of opioids among patients, which is called ISCR program. American College of Surgeons holds on a yearly basis a dedicated quality and safety conference. Due to COVID-19 this year, this conference was held virtually, but it provides a open platform for healthcare providers to talk about quality and patient safety issues. I want to share this slide. These are the 6 lessons learned up till now, which are published by American College of Surgeons. Number 1, quality improvement is the future of medicine. We have to embark on this pathway in order to make sure that we are at the front. Number 2, quality is measurable. You have to set the metrics right. Number 3, high quality data is essential for quality improvement. Validity of that data is extremely important, because you cannot make or find a solution about a problem if you don't know the problem. Number 4, quality thrives in a supportive culture. To me, quality is a team sport and will need buy-in from all stakeholders. Collaboration among individuals, hospitals, and at state and national level will drive innovation and higher quality standards. And at the last, surgeons must lead the quality initiatives. As natural leaders, it is imperative for us to take charge of our patients' needs. I wanted to share this video with you guys. Thank you very much, and I'm more than happy to take any questions. Thank you very much once again.